Welcome to the comprehensive course Fundamentals of Medical Billing and Revenue Cycle Management. This course has been comprehensively designed to equip healthcare professionals, aspiring billing specialists, administrators, and students with the foundational knowledge and skills necessary to navigate the complex landscape of medical billing and revenue cycle management effectively. Whether you are beginning your career in healthcare administration or seeking to upgrade your existing skills, this course provides a thorough understanding of the critical components that ensure the financial health of healthcare organization while simultaneously delivering quality patient care. Why this course is essential? In the rapidly evolving world of healthcare, revenue cycle management, also referred to as RCM, has emerged as a core function that directly impacts the financial viability of healthcare facilities. From small clinics to large hospitals, managing the life cycle of patients' accounts, from initial registration to final reimbursements, requires a strategic approach, technical proficiency, and an understanding of regulatory compliance. Errors and inefficiencies in billing processes can lead to revenue loss, claims denials, legal penalties, and patient dissatisfaction. This course aims to bridge the knowledge gap by providing a detailed overview of the entire revenue cycle, covering the critical areas such as healthcare systems, patient data management, medical coding, insurance processes, claims management, compliance, technology, and customer service, and advanced revenue tactics. The ultimate goal is to prepare participants not only to understand each stage, but also to optimize the revenue cycle for maximum efficiency, compliance, and patient satisfaction. Let us review each of the modules and subtopics we will be covering in this course. We will start with Module 1, Introduction to Healthcare Systems, the foundation, understanding healthcare systems. Our journey begins with a comprehensive exploration of healthcare systems, recognizing how healthcare organizations operate within various structures is fundamental to understanding the environment in which medical billing functions. Firstly, overview of healthcare systems. Healthcare systems around the world are diverse and influenced by governmental policies, economic factors, cultural norms, and technological advances. This module explores various models, including national health services, socialized medicine, and private healthcare, to understand their unique features and the implications for billing and reimbursement processes. Next, the structure and function of healthcare organizations. Healthcare organizations range from single physician practices to sprawling multi-specialty hospitals. This section examines organizational hierarchies, management processes, operational workflows, and the way these structures influence billing procedures and revenue flow. Next, the role of medical billing in healthcare delivery. Medical billing acts as the financial backbone that sustains healthcare operations. Its primary function is ensuring that healthcare providers are reimbursed accurately and promptly for their services. Proper billing guarantees not only the financial stability but also smooth patient experiences and regulatory compliance. Next, key stakeholders in healthcare systems. The healthcare ecosystem is composed of various stakeholders such as patients, providers, payers, also referred to as insurance companies and governmental programs, regulators, and vendors. Now, understanding their roles and interactions helps in designing effective billing strategies that enhance communication and streamline processes. Evolution and trends in healthcare. Healthcare is continually transforming, driven by technological innovations, policy reforms, and shifting patient expectations. Current trends include adoption of electronic health records, also referred to as EHRs, telehealth services, value based reimbursement models, and data analytics, all influencing how billing and revenue management are conducted. Next, Module 2, patient data and medical documentation. Managing the critical assets. The next module is focusing on patient data management and medical documentation are pivotal for accurate billing and legal compliance. Firstly, importance of accurate medical documentation. Accurate, thorough documentation forms the basis for correct coding, billing, and reimbursements. It ensures that services are correctly represented, reduces claims denials, and minimizes audit risks. Now, this section emphasizes establishing standards for documentation, quality, and consistency. Next, patient registration and verification processes. Now, initial patient registration is the first step in billing. It involves collecting demographic details, insurance information, and verifying patient identity and coverage. Proper registration prevents future claim issues and delays. Next, medical record keeping systems, electronic versus paper. The shift from paper to electronic health records, also referred as EHRs, has transformed medical documentation. This portion compares the advantages such as accessibility, security, and faster processing against challenging or challenges like cybersecurity threats and technological costs associated with EHR systems. Next, privacy and security of patients' data. Compliance with regulations like HIPAA is crucial in protecting patient confidentiality. Measures include encryption, access controls, and audit trails. Now, this section discusses safeguarding sensitive information in both electronic and physical formats. Next, legal aspects of medical documentation. Medical records are legal documents. Accurate, timely, and complete documentation can be critical evidence during audits, legal proceedings, or disputes. Understanding legal responsibilities and documentation standards is essential for compliance and risk management. Next, Module 3, laying the groundwork, medical coding basics. In this portion of this introductory overview, we delve into medical coding, the language that translates clinical information into standardized alphanumeric codes, vital for billing. These modules form the backbone of effective revenue cycle operations, ensuring healthcare providers can accurately document services and navigate complex insurance landscapes to secure rightful reimbursements while maintaining compliance. In today's healthcare environment, the accuracy of medical coding and a thorough understanding of insurance procedures are paramount. Medical coding translates complex clinical encounters into standardized codes that enable billing, statistical analysis, and data interoperability. Proper coding not only ensures that providers are fairly reimbursed, but also helps maintain compliance with federal regulations and reduces the risk of fraud or audit penalties. Likewise, understanding healthcare insurance fundamentals is crucial because most healthcare services are paid for through a patchwork of private and public plans. Navigating these systems effectively and efficiently aids in reducing claim denials, accelerating reimbursements, and improving patient satisfaction. Medical coding basics intends to demystify the coding universe. You learn how clinical details are transformed into universally recognized codes that facilitate billing and reimbursement processes. Firstly, Introduction to Diagnostic Coding, ICD-10. The International Classification of Diseases, 10th revision, also referred to as ICD-10, is the global standard for categorizing diagnosis. This part introduces the coding principles, structures, and purpose of ICD-10. You'll understand how accurate diagnostic coding supports treatment documentation, clinical data collection, epidemiology, and insurance claims. Next, procedure coding with CPT. Different procedural terminology, also referred to as CPT coding system, captures medical, surgical, and diagnostic procedures performed by healthcare providers. This module teaches how to select the correct CPT codes, interpret code descriptions, and utilize modifiers to reflect nuances in services. Next, HICPIC coding for supplies and services. Healthcare Common Procedure Coding System, also referred to as HICPICS. Codes extend CPT coding to include durable medical equipment, supplies, and certain services not covered by CPT. You will learn how HICPIC codes integrate with billing workflows, particularly for Medicare and Medicaid. Next, coding guidelines and compliance. Effective coding relies on strict adherence to coding guidelines, which are essential to ensure accuracy, consistency, and compliance. This section covers the importance of following official coding guidelines, understanding code updates, and avoiding common pitfalls that can lead to claim rejections or legal issues. Next, challenges and solutions in medical coding. Medical coding can be complex due to frequent updates, complex clinical scenarios, and documentation gaps. Now, this module discusses strategies to overcome common challenges like ongoing training, use of coding software, audits, and implementing quality control measures to maintain high accuracy. Next, module 4, navigating the insurance maze. Healthcare insurance fundamentals equips learners with foundational knowledge about the diverse insurance environment that interacts with the billing processes. Firstly, the types of insurance plans, HMO, PPO, and EPO. Understanding different plan structures helps clarify patient expectations and billing procedures. This section explores health maintenance organizations, preferred provider organizations, exclusive provider organizations, and their implications for provider network rules, authorization requirements, and reimbursement models. Next, government insurance programs such as Medicare and Medicaid. A significant portion of healthcare billing involves government programs. Here, you'll learn the eligibility criteria, coverage specifics, and unique billing rules associated with Medicare, primarily for seniors and certain disabilities, and Medicaid, which is a state administered program for low income populations. Proper handling of these claims is crucial for compliance and reimbursements. Next, key insurance terminologies such as premiums, deductibles, and coinsurance. A familiarity with insurance related terms is critical in explaining benefits to patients, estimating costs, and processing claims. This knowledge supports transparent communication and mitigates patient disputes. Next, the claims adjudication process. This process involves several steps from claim submission to review, at adjustments, and payments. Understanding how payers evaluate medical necessity, coverage limits, and coding accuracy helps in preempting rejections and streamlining workflows. Next, coordination of benefits and payer responsibilities. When patients have multiple insurance, the coordination of benefits determines primary and secondary payers. This segment lays out the policies to avoid overpayment, duplicate billing, and delays in reimbursements. Together, these modules provide a comprehensive understanding of how clinical data is accurately coded and supported by insurance processes that govern payments and compliance. Mastery of these areas boosts the efficiency and accuracy of the entire revenue cycle, decreases denials, and improves cash flow. By grasping the intricacies of medical coding systems, their applications, and the complexities of insurance plans and claim processing, students and professionals will be better prepared to handle real time billing scenarios. This knowledge promotes ethical coding practices, regulatory adherence, and ultimately the financial health of healthcare operations. Next, Module 5 and 6, claim management process and financial management in healthcare. These critical modules and sections delve into the practical and strategic aspects of managing healthcare revenue, ensuring that providers maintain financial stability while delivering quality patient care. Effective claim management and financial oversight are at the heart of a successful healthcare operation. Even the most accurate coding and documentation can falter if claims are mishandled, denied, or delayed. Conversely, robust financial management practices help healthcare organizations optimize revenue, control costs, and plan for long term sustainability. The comprehensive segment aims to equip learners with a thorough understanding of how to manage the entire claim life cycle efficiently, from submission to resolution, and how to implement Sound financial strategies that enhance cash flow, reduce errors, and support organizational growth. Claim management is a fundamental function that directly influences reimbursement rates, cash flow, and compliance. Learning how to prepare, submit, monitor, and resolve claims effectively can significantly reduce denials and delays. Firstly, we'll review components of clean claim. A clean claim is complete, accurate, and compliant with payer requirements. This part teaches you how to ensure that all necessary information, such as correct patient details, accurate coding, proper documentation, and timely submission, is included to avoid common errors that lead to rejections. Next, claim submission and processing stages. From electronic or paper submission to the final adjudication, every stage involves specific processes. You will learn how claims are routed through clearinghouses, how payers review and adjudicate claims, and the importance of following deadlines and technical specifications. Next, identifying and handling claim denials. Despite best efforts, claims may be denied or rejected. This section provides strategies for quickly identifying denial reasons, such as improper coding, missing documentation, or eligibility issues, and effective methods for correcting, resubmitting, or appealing denials to recover revenue promptly. Next, reimbursement methodologies. Different payment models, such as fee for service, bundled payments, capitations, value based models, affect how healthcare providers get reimbursed. Understanding these methodologies helps in planning workflows, negotiating payer contracts, and maximizing revenues. Next, strategies to maximize claim approval. Proactive measures such as ongoing staff training, implementing automated workflows, real time claim editing, and conducting regular audits are essential. This part focuses on best practices to increase claim acceptance rates and streamline revenue collection. Next, Module 6, Financial Management in Healthcare. Beyond individual claims, overarching financial management ensures that healthcare entities maintain healthy cash flows and effective resource utilization. This module covers strategic financial operations that sustain the organization long term. We'll review revenue cycle, life cycle, and financial flow. This overview illustrates the complete flow from patient registration, service delivery, claim submission, payment receipt to final collections. Understanding this cycle allows staff to identify bottlenecks and optimize the overall process. Next, managing accounts receivables and collection. Effective accounts receivable management involves timely follow up on unpaid claims, patient balances, and collections. Techniques such as automated reminders, dedicated collection teams, and clear payment policies help improve collection rates. Next, financial analysis, budgeting, and forecasting. Using historical data and current trends, organizations can develop budgets and financial forecasts. Now, these tools guide strategic decision making, resource allocation, and performance evaluation. Next, performance metrics and reporting. Tracking key indicators such as days in accounts receivable, denial rates, collection effectiveness, and revenue per provider allows organization to monitor financial health, identify issues early, and implement corrective measures. Next, cost control and improvement strategies. The cost management is essential for maintaining profitability. This includes analyzing operational expenses, reducing waste, negotiating better payer contracts, and investing in efficiency enhancing technologies. Together, these modules provide a comprehensive framework for mastering the complexities of claim management and financial stewardship in healthcare. They empower professionals to reduce claim rejections, accelerate reimbursements, and make informed financial decisions that support organizational growth. By understanding the detailed processes involved in claim submission and denial management, coupled with strategic financial planning, healthcare providers can optimize revenue streams, achieve compliance, and improve patient satisfaction. This knowledge equips you to be an effective steward of healthcare finances, driving success in a competitive and regulated industry. In essence, mastering claims management and financial strategies is essential for a resilient and thriving healthcare practice. These skills ensure that healthcare organizations not only recover revenue owed for services rendered, but also invest wisely, plan proactively, and sustain their mission of delivering exemplary care. This course segment aims to develop your competence in these vital areas, preparing you to navigate the financial intricacies of healthcare with confidence and next module 7 and 8, compliance, ethics, and technology in medical billing and revenue cycle management. These pivotal modules of the course focuses on compliance, ethical practices, and technology. As the healthcare industry becomes increasingly complex, understanding legal standards, ethical responsibilities, and technological advancements is essential for ensuring accurate, lawful, and secure billing operations. In today's healthcare environment, adherence to regulatory requirements and ethical standards isn't just a matter of best practice. It's a legal obligation that protects providers from penalties, fines, and reputational damage. Simultaneously, rapid technological developments are transforming how billing is managed, offering opportunities for greater efficiency, security, and improved patient care. This segment of the course aims to equip you with the knowledge to develop robust compliance programs, uphold ethical standards, and leverage cutting edge technology effectively. You will learn how to navigate complex regulations, identify and prevent fraud and abuse, and understand the role of innovative tools that are redefining healthcare billing. Module 7, compliance and ethical practices. Compliance and ethics are the cornerstone of trustworthy and sustainable healthcare billing practices. Firstly, importance of compliance and medical billing. Compliance ensures that healthcare providers follow applicable laws and regulations, avoiding legal penalties and audits. Proper compliance protects both organization and patients and supports accurate reimbursements. Next, key regulations: HIPAA, False Claim Act, and Stark Law. This section provides an overview of critical legal frameworks. Firstly, HIPAA, also referred to as Health Insurance Portability and Accountability Act, it focuses on protecting patient privacy and data security. False Claims Act, it addresses false or fraudulent claims submitted for payment, emphasizes the need for truthful billing. Stark Law, it prohibits physicians' self-referral to entities with which they have financial relationships, preventing conflict of interest and fraud. Next, implementing a compliance program. Creating an effective compliance program involves establishing policies, training staff, conducting audits, and continually monitoring adherence to laws. This proactive approach minimizes risks and fosters an ethical workplace culture. Next, identifying fraud, waste, and abuse. Healthcare fraud involves intentional deception. Waste refers to overuse or mismanagement. Abuse includes billing practices that are inconsistent with accepted standards. Recognizing signs early helps prevent financial and legal repercussions. Ethical standards in billing practices. Upholding integrity, transparency, and fairness is essential. Ethical billing involves accurate coding, full disclosure to patients, and adherence to regulatory guidelines. Next, Module 8, Technology in Medical Billing. Technology has revolutionized healthcare billing, making processes more accurate, secure, and efficient. Firstly, Introduction to Medical Billing Software. Modern billing relies on specialized software that automates claim generation, edits, submission, and reporting. Learning how to utilize these tools improves productivity and reduces errors. Next, role of electronic health record system. EHRs have become central to capturing comprehensive patient data, facilitating accurate coding, and streamlining business billing processes. They support interoperability and data sharing among healthcare providers. Next, data sharing and cybersecurity measures. Protecting sensitive patient and financial data is critical. Now, this section covers best practices such as encryption, access control, regular audits, and staff training to prevent data breaches and comply with legal standards. Next, telehealth and its impact on billing. The rise of telehealth has expanded service delivery, but also introduced new billing challenges, including coding, documentation, and reimbursement policies specific to remote services. Emerging technologies in healthcare billing, innovations such as AI driven analytics, blockchain for secure transactions, and mobile payment platforms are shaping the future of healthcare billing. Staying focused about these trends helps organizations remain competitive and compliant. Together, these modules underscore that compliance, ethical integrity, and technological advancements are central to modern medical billing and revenue management. Compliance safeguards the organization from legal risks, while ethical practices build trust with patients and payers. Simultaneously, leveraging advanced technology streamlines workflows, enhances security, and prepares organizations for the future of healthcare. By mastering these areas, you will be equipped not only to execute billing tasks accurately, but also to foster a compliant, ethical, and innovative billing environment. Key factors in sustaining the financial health and reputation of healthcare organizations. This knowledge positions you as a responsible and forward thinking professionals capable of navigating the evolving landscape of healthcare reimbursement with confidence and integrity. Next, Module 9 and 10, Customer Service, Advanced Revenue Cycle Management, and Future of Healthcare Billing. In this final modules of the fundamentals of medical billing and revenue cycle management course, we focus on the human element, effective patient interactions, and outstanding customer service, as well as advanced strategies for optimizing revenue cycle performance. These modules are designed to help you not only perform your daily tasks efficiently, but also to elevate your organization's financial health through strategic improvements and innovative practices. In healthcare, effective communication with patients and adapt management of revenue processes are vital for success. Building trust and providing excellent service fosters patient satisfaction, loyalty, and better cooperation, which directly impacts billing accuracy and collections. Furthermore, understanding advanced revenue cycle strategies enables organizations to enhance financial performance, manage denials more effectively, and stay ahead in an increasingly competitive healthcare environment. This part of the course empowers you with skills in patient engagement and introduces you to innovate practices that support organizational growth. You will learn how to handle billing inquiries professionally, resolve disputes efficiently, and implement continuous process improvements grounded in future trends. Module 9, Customer Service and Patient Interactions. In this customer centric era of healthcare, your ability to communicate effectively with patients can significantly influence your and their experience and perceptions of your organization. Firstly, effective communication skills for billing professionals. Clear, compassionate, and professional communication reassures patients, clarifies billing details, and helps prevent misunderstandings. This section emphasizes active listening, empathy, and clarity in explaining charges, insurance coverage, and payment options. Next, handling patient inquiries and complaints. Patients often reach out with questions or concerns. Developing a systematic approach to addressing inquiries, whether via phone, email, or in person, ensures issues are resolved swiftly and satisfactorily, reducing stress and building trust. Next, techniques for resolving billing disputes. Disputes can occur over charges, denials, or insurance coverage. This section guides you through conflict resolution strategies, including fact finding, documentation review, and establishing resolution pathways that prioritize transparency and patient satisfaction. Next, building trust and rapport with patients. Trust is foundational. Demonstrating professionalism, transparency, and genuine concerns fosters a positive relationship which encourages timely payments and patient loyalty. Techniques include clear communication, consistent follow up, and demonstrating respect. Next, improving patient satisfaction through service excellence. Beyond billing accuracy, delivering courteous, prompt, and attentive services enhance overall satisfaction. Satisfied patients are more likely to pay promptly, refer others, and remain loyal to your organization. Module 10, Advanced Revenue Cycle Management. In a competitive healthcare landscape, organizations must go beyond basic processes to implement strategic, forward thinking revenue management practices. Firstly, strategies for revenue enhancements. Explore innovative approaches such as engaging in patient renegotiations, expanding service lines, and leveraging data analytics to identify new revenue opportunities. Workflow automation in revenue cycle. Streamlining workflows reduces delays and errors. Now, this involves automating repetitive tasks, integrating systems like EHR and billing software, and establishing standardized procedures. Next, denial management and root cause analysis. Denials can significantly hinder cash flow. Learning how to analyze denial patterns helps identify systemic issues such as documentation gaps or coding errors, and implement corrective actions to reduce future denials. Next, continuous improvement and process innovations. Healthcare revenue management is dynamic, embracing a culture of ongoing assessment, process refinement, and adopting new technologies ensures resilience and sustained performance. Next, future trends in revenue cycle management. Stay ahead of the curve by understanding emerging trends such as artificial intelligence, predictive analytics, blockchain, and patient portals that are shaping the future of healthcare revenue management. Preparing for those innovations ensures your organizations remains competitive and compliant. The final takeaway: these advanced modules are designed to deepen your understanding of how strategic, person centered, and innovative approaches can profoundly influence your organization's revenue and patient relationships. Mastering effective communication enhances patients' loyalty and simplifies billing interactions, while adopting innovative revenue cycle strategies ensures sustained financial health and adaptability amidst a rapidly changing healthcare landscape. By completing these modules, you will be empowered to deliver not just accurate billing, but also a superior patient experience and to lead your organization towards efficiency, growth, and excellence in revenue management. This comprehensive knowledge sets you apart as a professional capable of shaping the future of healthcare billing, focused on integrity, innovation, and exceptional service. Thank you.